You know that feeling when you spend more time wrestling with healthcare paperwork than you do actually talking to your doctor? It's the worst. Well, today, we're diving into a new kind of AI system that's designed to fix exactly that. It's basically a digital support team built to slice through all that clerical chaos, letting doctors get back to focusing on what really matters, which is you. So, let's see how this thing actually works.
But before we get into the tech, let's just ask the big question. I mean, we've all been there, right? You're stuck on hold, or you're filling out the same exact form for the 10th time. And you just have to wonder, why is healthcare admin so incredibly complicated? It's a frustration we all share, and it's the heart of the problem we're tackling today.
And look, this whole mess isn't just a small annoyance, right? It's a full-blown administrative nightmare. And it's not just about us being frustrated as patients. It creates real, tangible friction inside the healthcare system. The kind of friction that can actually delay a diagnosis or even impact the quality of care someone receives.
Just think about it for a second. The journey of just one single doctor's visit is loaded with these bottlenecks. First, you've got the delay just trying to schedule the appointment. Then the doctor might be flying blind with a patient history that's not even complete. And after all that, someone's got to sit there and manually type everything into the system, adding to this just mountain of paperwork. Every single one of these steps pulls time and focus away from what's supposed to be happening, actual care.
So, how do we fix this? Is there a better way? Well, that's where this project we're looking at comes in. It's called Nightingale Nexus. And the key here is to stop thinking about it as just another piece of software. Instead, picture it as a dedicated digital support team for your doctor's office.
Okay, so what is it, technically speaking? Well, Nightingale Nexus is what's called a multi-agent AI healthcare assistant. Now, the two big phrases to remember there are multi-agent, and don't worry, we'll unpack that in a minute, and its whole reason for existing, to automate all those clinical workflows and just get rid of all that clerical overhead.
So, as you can probably guess, its mission is absolutely laser-focused on fixing those pain points we were just complaining about. We're talking about automating patient scheduling, maintaining records that are actually clean and structured, giving doctors the context they need right when they need it, and of course, streamlining how a diagnosis gets documented.
All right, now this is where it gets really cool. This thing isn't some giant single AI that tries to do everything. No way. It's designed as a team of specialized AI agents, where each one has a very specific job to do. So, let's meet the crew.
First up, we have Sheila. Think of Sheila as the most efficient front desk coordinator you've ever met. Her one and only job is to get patients into the system and onto the doctor's calendar completely smoothly, no hassle whatsoever.
So, how does she do it? Well, imagine a patient just emails the clinic describing their symptoms. Sheila jumps on it instantly. She reads the email, pulls out all the important info, and then checks the doctor's calendar for an open slot. From there, she registers the new visit in the system and boom, sends a confirmation right back to the patient. It's this perfect, seamless four-step process that just happens automatically in the background. And you can see the impact right away. Because Sheila is handling that whole intake dance, she's freeing up the human staff to deal with more complex issues. She's cutting down on all those repetitive tasks and just making the whole process of booking an appointment way faster and easier for everybody.
Okay, on to the next member of our digital team. Meet Brian. Now, if Sheila's running the front desk, Brian is like the doctor's personal research assistant. His whole gig is to make sure the doctor has every piece of relevant information summarized perfectly right before the patient even walks through the door.
Now, what's really fascinating about Brian is that he's actually what's called a sequential agent. You can basically think of him as a little two-part team in one. First, a sub-agent called the Retriever dives into the database and pulls up the patient's entire medical history. Then, part two, the synthesizer, takes all that raw info and boils it down into a super concise doctor handoff brief. It's the perfect summary, delivered just in the nick of time.
And this is so critical. It means the doctor doesn't have to waste those first precious minutes of an appointment digging through old files. Nope. They get a clean, clear summary right up front. And that helps them make faster, better-informed decisions right from the very start of the visit.
Okay, so that brings us to the final member of the team, Clara. Her job kicks in after the appointment is over. You can think of Clara as the super diligent, detail-oriented data clerk who takes care of all the follow-up paperwork.
And her workflow, it is a thing of beauty, seriously. As soon as the doctor finishes their notes, Clara is on it. She reads the notes, extracts the diagnosis and the treatment plan, updates the patient's official record in the database, and then confirms that everything was saved successfully.
I mean, this is all done before the doctor has even had a chance to move on to their next patient. It's that fast.
And let me tell you, this is a huge deal. Manual data entry isn't just tedious, it's one of the biggest sources of errors in healthcare. So by having Clara automate these updates to the electronic health record, you're not just saving a ton of time, you're also making the patient data itself more accurate and reliable. That's a massive win.
So we've met Sheila, Brian, and Clara. But it makes you wonder, right? Why build it this way? Why not just have one giant AI do everything? Well, the answer is pretty simple. A team of specialists is almost always smarter, safer, and stronger than one person trying to do it all. And this really breaks down why. First, it's modular. Each agent is a specialist, which makes them way easier to build, test, and maintain. Second, it's scalable. Let's say you want to add a new skill, like handling prescription refills. You don't have to rebuild the whole system. You just add a new agent to the team. It's also much safer, because you can give each agent access to only the tools and data it absolutely needs for its job, and nothing more. And finally, it boosts accuracy. When each agent is hyper-focused on doing just one thing, they tend to do it really, really well.
But here's the real magic behind all of this. This whole structure, it's not just some random technical choice. It's designed to mirror how real hospital teams actually work, right? You've got your specialists for intake, for background research, and for keeping the records straight. And because it works like a human team, the whole system just feels more intuitive, making it easier for people to understand and actually use.
Look, this team-based approach is obviously super powerful for fixing the problems we have right now. But what gets really exciting is thinking about where this tech could go next. We're not just talking about patching up the current system anymore. We're talking about laying the groundwork for the AI-augmented hospital of the future. Just picture this. A doctor is about to prescribe a new medication. Instantly, an AI assistant pops up on their screen, and it's already checked that prescription against the latest medical guidelines and the patient's entire history. It could flag any potential drug interactions right then and there. I mean, that's real-time decision support that could literally save lives. Or, hey, what about telemedicine? Instead of having to fight with some clunky, confusing web portal, a patient could just describe their issue in plain language, and the system could instantly route them to the right virtual specialist, book the appointment, and handle all the logistics. It would make getting remote care totally seamless.
Because at the end of the day, the ultimate goal here isn't just to build a few handy assistants. The real vision is to evolve this prototype into a full-featured AI hospital operations platform, something that can help manage the incredibly complex logistics of an entire hospital.
And this final quote, I think, just brings it all home perfectly. The idea that AI agents can cooperate just like a trained medical support team, that's the whole foundation. This was never about replacing people. It's about augmenting them. It's about clearing away all that tedious junk to make way for healthcare systems that are smarter, faster, and more focused. Systems that can actually scale to meet real-world demand. It really makes you wonder what other parts of our world could be transformed by a team of specialized AIs. Definitely something to think about. Thanks for tuning in.